Thank you for joining us for this Review Renew ACLS tutorial. These are BLS concepts, and today we're going to talk about ventilations. We're going to get down to it, so just remember, this style of ventilations is for anyone whereby you have checked for pulse and breathing, and your patient has a pulse, but they are not breathing. We will perform ventilations. Let's go. First, let's discover the different delivery methods of ventilations. One way is to give mouth to mouth, as seen on the picture. Another way is mouth to mask, which you guys will see demonstrated when you come to class. And manual resuscitator bag is a very common way in medical facilities, and this is how you will practice in class as well. When positioning your patient for ventilations, you want to make sure they are in the sniffing position, and that is also known as the head tilt, chin lift to healthcare professionals. You also want to make sure that the mask is completely secured by using the technique called the EC clamp. You will practice this when you come to class as well. Let's look at the different populations for ventilations. For adults, we want to deliver a breath every 6 seconds. For infant and children, we want to deliver a breath every 3 seconds. When you use the EC clamp with the manual resuscitator bag, you want a complete seal ensuring that the breath is sufficient. You will look for chest rise to make sure that the breath is delivered. For adults, you will count 1 and 2 and 3 and 4 and 5, then squeeze the bag, that is. 1 and 2 and 3 and 4 and 5, then squeeze. Or you could just think 1 and 2 and 3 and 4 and 5, then breathe. 1 and 2 and 3 and 4 and 5, then breathe. You want to make sure that the breath is delivered on the 6th second. You will deliver the breaths for at least 2 minutes before reassessing. So that means for the adult population, if you deliver a breath every 6 seconds, you will have given approximately 20 breaths total for 2 minutes. For children, you're going to deliver a breath every 3 seconds because they breathe faster. So in this case, it goes like this: 1 and 2 and 3, 1 and 2, then squeeze. 1 and 2, then squeeze. 1 and 2, then squeeze. Making sure that the chest is rising. Again, we will do this for 2 minutes, and these kids will get approximately 40 breaths over 2 minutes. Again, kids breathe faster. Bring your questions to class. We will discuss them together, but get ready to practice. You guys should know the appropriate amounts, and you should know what to look for to determine effective breathing. Again, that's your chest rise. Whenever asked, how do you know ventilations are effective, you should know it's chest rise. It's simple, it's easy, and most of us understand this. How long are we going to give ventilations? We give ventilations for 2 minutes. Now remember, when we're doing rescue ventilations, this is for someone who has a pulse, but they are not breathing. Okay, for 2 minutes, we will deliver the breaths for them, and then we will reassess for pulse and breathing. Thank you guys for joining us for this Review Renew ACLS tutorial covering ventilations. You can contact us for anything. We are Review Renew ACLS. You can find us online at https://reviewrenewacls.com. You can text or phone us at 407-329-8346. Again, thank you guys, and we'll see you in class.